I weighed 270 pounds.
I was 367 pounds.
Prior to surgery, I was around 425 pounds.
I gained probably about 110 pounds.
6'3", weighed 370 pounds.
I got married, had my children, and the weight just kept on getting higher and higher and higher.
Obesity has been rising both worldwide and the United States, especially morbid obesity.
Many of the life insurance studies have shown that people who are morbidly obese have a tendency to die 15 years sooner than people who aren't obese. So that being the case, health issues that are related to obesity, such as diabetes, hypertension, coronary artery disease, hyperlipidemia, those are all things that can be reversed with weight loss. And the National Institute of Health has found that the weight loss surgeries are the most effective way to lose weight in someone who is morbidly obese.
We offer two types of bariatric surgery. The first is the gastric bypass surgery, which is the most common surgery that people recognize with bariatric procedures. In that procedure, what we're doing, we're actually reducing the size of the stomach and forming a small pouch with the upper part of the stomach, so it only accommodates about an ounce or so of food. We're also bypassing the upper part of the intestines, so less food is absorbed. So with the gastric bypass, less food is consumed and less food is absorbed, so the weight loss is fairly quick with that procedure. The other procedure that we offer is the laparoscopic adjustable band. In this procedure, what we're placing is a small restrictive collar that's adjustable up around the upper part of the stomach. And that forms a small little pouch just by the adjustability of that band. There's no malabsorption to it, and weight loss is basically by decreasing the amount of food somebody's taking in and decreasing their hunger. What we try to do is educate the patient about both procedures, both the risks and benefits of each of these procedures, and then decide what is going to be best for them, and let the patient decide what is going to be best for them based on their weight and other medical conditions related to their obesity.
It's not a miracle thing, you know. People do think that it's okay, yeah, well, I'll just go have it done and that's it. No, but you have to show in the program that you have a commitment to get it done, which is a great thing because, you know, it gives me time to think, is this the right thing for me?
To become a candidate for our program in our bariatric center, what we try to do is have the person attend a community seminar. Those are given locally several times a month in different locations, and we try to make that available as a free service to the public to give some information and education regarding bariatric surgery.
Well, actually, I went to one of the community meetings probably 3.5 years ago at Frick, and it took me 1.5 years from that time, after listening to the program and everything, to finally make up my mind to give them a call and do something. So even though I was in bad shape at the time I went to the meeting, it still took me 1.5 years to finally make up my mind. So.
I attended a meeting with my wife. After the meeting, we went home, and we sat and talked and talked and talked and said, is this the way that I should go? And I really didn't know if I had a choice, but I also have 3 children and a grandson who need me to be here. And that inspiration alone was enough to decide this is a way that I could do this. Although very scared, decided to venture forward with it and set up an appointment to meet with the doctor and the dietitian here.
What we do even before the surgery, for the first 6 months, they're meeting with a dietitian, they're meeting with an exercise therapist, they're relearning how they should eat. Because after any of these procedures, what we're trying to reteach is behavior. What foods to eat, making lifestyle changes both from an exercise standpoint and a nutritional standpoint. And these are changes that they need to follow along for the rest of their life. And that's why it's so important that they follow through with the program and that we will see them for the rest of their life through the program.
At first I was amazed. I thought, I don't know if I'm going to be able to follow all this. But going through each month, it was a very eye-wakener knowing that the diet was a very, very big part of this. And I was going to have to make this lifetime change. And And so month to month, with the help of the nutritionist and with learning to start doing different exercises, that I could, do this, and that's what made me decide I could.
I knew I could do it, and it was only a 6-month process, and I just had to follow the plan, listen to the dietitian, listen to the doctor, and I would get there. I'd eventually get to the goal of the surgery and have all the rewards afterward.
You start to feel your energy, although you feel like you're not eating the right amount of foods, you're eating the right foods. And all of a sudden the energy level is starting to pick up. And then when you're not dragging this excess weight around with you, all of a sudden you're more active, and all of a sudden you're not doing more things than you've ever thought you could do before.
Follow-up is very important. Patients tend to regain the weight when they fall off their program, or they don't follow up with their dietitian or follow up with their surgeons. And we're committed to seeing these patients for the rest of their life to make sure that they maintain those lifestyle changes that they need for continued weight loss.
I have a pizza restaurant in the area here, and I've been doing it for 24, 25, going on my 24th year. And that was a big thing for people to say to me, "Oh, how are you going to have this surgery? I mean, you eat pizza every day." Well, it was getting back to what I said about, my life changing. And I eat pizza. I still eat pizza. I just don't eat a lot of it. I am satisfied with the amount that I do eat.
I love to cook, and that's not an issue for me because I was always, I'm Italian background, so lots of food, but I was always a cooker for other people. That doesn't bother me. I still cook the same as I did, pre-surgery. I cook whatever the boys want, and I just don't eat it. Or I just eat a little bit of it, or only can eat the things that agree with me.
You can eat. Yes, it's in moderation, but there's nothing out there that you can't eat. I can eat anything. People will say to me, "Well, don't you miss eating?" I said, "No, I don't miss it at all. If I want a piece of pizza, I have a small piece. If I want a cookie, I don't have that." But there's nothing I can't eat. And they say, "Well, you can't eat?" Yeah, I can eat it. I could eat that cookie. I could eat that candy. I could eat anything I want. But it's what I've chosen not to do now.
Plus, I've also used the support groups at the Bariatric Center, where we meet once a month at the end of the month, and get to hear other people's stories and get some tips from them on things that you can do as far as your eating and everything.
I think the biggest difference between people trying our program and various weight loss programs that have been instituted over the past few decades is this isn't something where we try a fad diet or try something that is so very different from a balanced diet. It's something we can use to educate the person about the lifestyle changes they're going to have to make, and again, it's going to be a permanent change in lifestyle. The surgery is a small tool that will help them get to their overall goal of weight loss and reversing the problems that they've had with their health.
Right now I weigh 135 pounds, which is exactly half of me.
I was 367 pounds the day I walked into the program. And I am about 240 now. And I still have probably another 25, 30 pounds to go.
I like what I see in the mirror now, yes. It's nice going clothes shopping. You just pick something off the rack and take it home and you don't have to try it on.
Oh, I would say go for it. I'd scream it from the mountaintop if I could. If they're really serious about making the commitment, this isn't a New Year's resolution where you start at January 1st and by the 15th or the 16th you decide, oh well, I'm done with this. If you're serious about it and you really want a healthy lifestyle and feel wonderful and great again, I would recommend it to anyone out there.